Welcome to the 247th of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at the Korea Advanced Institute of Science and Technology. I'm coming to you live from Daejeon, South Korea. Today is a discussion of historically Black colleges and universities and public health in Nashville with Andrea Ringer, Larotha Williams, and A. Hannibal Leach. Just a reminder, you can catch COVID Calls live at its new time weekdays at 5:30 p.m. Eastern Time on YouTube. Just go to the COVID Calls YouTube channel to watch. You can hear COVID Calls anytime, recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID Calls via Twitter using the handle @US of Disaster or @COVID Calls. Please help spread the word and send suggestions for future guests and future topics, and please feel free to suggest yourself as a future guest. As of today, March 26th, 2021, there are 2,757,473 deaths globally from COVID-19. That's according to the Johns Hopkins University Coronavirus Resource Center. The death toll in the United States from COVID-19 has climbed to 546,825. 11,692 of those deaths come from the state of Tennessee. As a way to bring some humanity to the numbers, I've been reading a life story or a story of advocacy for those impacted by the pandemic, and I'd like to continue that now. Headline is, "Her Love Kept Patients Alive for a Little Bit Longer." This was written by Eli Kahan and was published in Kaiser Health News. Sivy Robertson was a nurse in Hopewell, Virginia, at Wonder City Rehabilitation and Nursing Center. Michaela Jones has two siblings, but remembers as a child thinking of all her neighbors in small-town Virginia as a family. Her mother, Sivy Robertson, opened her door to children across Petersburg, housing anyone who needed a place to sleep and feeding those without enough to eat. Among Robertson's delicacies, fresh-baked lemon tarts and sweet potato pies. "She was Mama Bear to all of us," Jones said. Robertson had foregone a youthful dream of becoming a nurse. When her daughter became a nurse at age 22, Robertson reconsidered. 5 years later, she graduated from Centura College in Virginia Beach. Robertson cherished her work. "For lovers and nurturers like my mother, you can't just set boundaries," Jones said. Her love kept patients alive for a little bit longer. That love motivated her during the pandemic, Jones said. Robertson was scared, her daughter said. Her mother told her that the virus was not controlled at all where she worked, and she brought her own protective equipment, Jones said. On December 5th of last year, Robertson was feeling ill and tired, her daughter said. On the 12th of December, she was hospitalized, and an hour into the year 2021, she died. Richmond Times-Dispatch reported that 67 residents and 25 staff members became sick with COVID this winter. At least 10 people died. That followed a spring outbreak at the facility in which 31 people were infected and 5 died, the newspaper reported. Okay, I'd like to turn to our conversation for today, and let me introduce my guests. This is one of the partnership episodes today. I'm really happy to announce this is a partnership that I've been doing with the LePage Center for History, the Page Center for History in the public interest at Villanova University, and the projects that we've been talking about have just been wonderful, so I'm really excited to talk about today. So let me introduce my guest. Dr. A. Hannibal Leach is the Interim Assistant Dean of the School of Humanities and Behavioral Social Sciences of Fisk University. He's also an Assistant Professor of Political Science and Director of the African American Studies Program. He is the author of The Social Context of Public Opinion and Foreign Policy, which explores the role social identity plays in shaping mass attitudes toward U.S. foreign policy. His current research uses computational methods to understand how critical race theory helps to explain political phenomena in the context of international politics and amongst American political leadership. Dr. Leach also authors a tri-monthly publication known as the Leach Political Report. The publication provides an informed Black perspective on political issues concerning the American South. Dr. Andrea Ringer is an Atlantic World Scholar at Tennessee State University with a focus on the history of transnational workers. Her current project asks questions about the circus as a workplace and the history of its migrant laborers. Using more than a dozen archives from across the country, interviews, trade journals, and hundreds of local newspapers, her work explores how the relevancy of the circus depended on the blurred lines between worker and performer. Her previous publications explore punitive justice and prison privatization, and she currently has 2 articles on circus workers currently in revision, and you can catch her recently published article, Because It Is Cheaper and Better, 1980s Corrections, Policies, and Prison Privatization in Tennessee in the Tennessee Historical Quarterly. Our third guest is Larotha Williams. Dr. Larotha Williams Jr. is a scholar of African American Civil War and Reconstruction and public history at Tennessee State University. Dr. Williams has worked as a historic science specialist for the state of Florida, acted as coordinator of the African American Studies program at Armstrong Atlantic State University, and served as a trustee of the historic Savannah Foundation in Savannah, Georgia. At Tennessee State, he coordinates the North Nashville Heritage Project, an effort that seeks to encourage a greater understanding of the history of North Nashville, including but not limited to Jefferson Street and its historic relationship to the greater Nashville community. His most recent publication is a work he co-edited with Amy Thurber entitled I'll Take You There, Exploring Nashville's Sites of Social Justice, which will be published by Vanderbilt University Press in April 2021. Andrea Ringer, Hannibal Leach, and Larotha Williams, thank you so much for joining me on COVID Calls today.
Thank you for having us. It's a pleasure.
Thank you.
So, Dr. Williams, I think you may be muted, so we'll just take you off the mute there, and then we're good. It's good to see you. So I would like to start the way I usually do, which is just ask people where they're calling in from and what the pandemic looks like there. And if you're all in Nashville, that's fine, because you can even tell us down to the neighborhood level how things are looking. It's usually quite interesting to find out. Hannibal, can I start with you, please?
Yes, and thank you again. Thank you for having us. Greetings to all of your viewers and listeners. I am calling in from Nashville, Tennessee, North Nashville, Tennessee. Fisk University is a private, historically Black college university, HBCU in North Nashville. The pandemic at our level is, it's still pretty devastating. It's still pretty shocking. But there is a sliver of hope that things are turning around at this point. We had a mass vaccination event take place here in Nashville just about a week ago, and a lot of people were vaccinated. I think we're at 13% in Nashville having people vaccinated. So that's a good, that's something that's good. And there are plans underway to have more mass vaccination. The President of the United States announced just yesterday that the goal of his administration is to have those vaccines available for everyone, whoever wants to get a vaccine available, May 1st. So I'll stop there before we even get into the dynamics of, is everyone feeling comfortable of taking the vaccination, and which one will be available. But right now, I think that, we're still in the throes of it. We're still in the mix of it, but it's good to see some light at the end of the tunnel.
Well, thank you for that orientation. Larotha, let me give you a chance to sort of tell us a little bit about how it's been looking in your neighborhood. And I'm particularly interested too in a state like Tennessee. I don't know if this is correct, but quite often we end up with a situation where big cities in red states, there's a sort of governance issue back and forth between the state capital and the city. I wonder how that might be playing out there in Nashville.
Um, when we first entered into this time that we're in right now, was very disturbed because you had these tensions in the city between folks that wanted to wear masks and then others who were reluctant to do so. I think things are getting a little bit better now. I just got back from Walmart before I came on here, and I'm one of those guys that'll go into the spaces and look and see who's wearing masks. So we're doing better in that regard. You still have some tension between those who want the vaccination and those who do not. And I don't know, as far as Nashville is concerned, I think we're doing a pretty good job because we've had 2 mass vaccination events over the last month or so. And I think they vaccinated, 10,000 people last weekend. So in Nashville, I think it's okay, but in other areas of the state, I'm not so sure. I was in Wilson County a couple of days ago, and they had an event, and the line had to be. They did it. The way they were vaccinating folks. They were doing a drive-through, right? So they had like 3 lines of cars, and you drive up and get a shot in the arm, and that line had to be half a mile, if anything. So wow. They were getting the job done, but I'm not so sure about the rural areas, so I can't speak to that. Going downtown is still a bit problematic because Nashville is known for its tourism, and you can go downtown, you can see people still gathering in large groups without masks. The bicycle taverns, which I hated before hated them before the coronavirus, but now they're still going through yelling at people without masks. So getting mixed messages here. In the bluer areas, I think we're doing as best as we can, but in the other areas, I'm not so sure.
I love the idea that you're the kind of guy who will go to a Walmart to check out if people are wearing masks or not. That's going to stick with me. I appreciate you sharing that detail.
Wait.
Andrea, let me bring you in on this. Just initial sort of your sense of the situation there.
Yeah, so I live in Southeast Nashville. Nashville released a heat map every Tuesday, and so the darker red areas were the places where COVID was concentrated. So it organized it by zip code, and I live in the darkest red area where COVID was always hitting. There's a high population of essential workers in this area, but like Dr. Williams, when I'm not going out and people watching for masks, but what I do notice in this area is people are wearing masks, right? It's just that we have a lot of construction workers that work in this area, right? And that's one of the hot spots in Nashville. The other weird thing about living down here is I'm about a mile away from the county line. So we're in a state that didn't do a statewide mask mandate. Nashville did, but the county neighboring, right, the county to the south of us, the mask mandate's already gone. And so it's been a very odd thing when you do cross that county line that people aren't wearing masks, right? The minute they didn't have to, they stopped by and large. So Southeast Nashville is sort of an odd place to be, where you just 1 mile away and it looks so radically different.
Well, I'm sorry it's been so bad in your neighborhood, and what a interesting perspective too. People say those kind of public health announcements and requirements don't matter, but literally as you cross a county line, you see that it matters. Well, I'm so pleased you all could join me, and congratulations on winning that LePage grant. And we have lots of things to talk about today. I think it would be good, though, to set the stage a little bit for listeners who might not be as familiar. And Dr. Leach, I'm going to start with you, and then I'll bring others in, just to give us a little bit of an understanding of the history of historically Black colleges and universities in the United States. I know it's impossible to get you to summarize it. It's such a vast history, but maybe just hit some of the high points of it so that people can understand where we're coming from on this topic.
Yes, most certainly, and I think Dr. Williams will be the best for this question. But I will say that as far as as Fisk University is concerned, and you can kind of look at Fisk University as sort of like the composite for HBCUs more broadly in America. It was founded right after the Civil War. Where before the Civil War, you really didn't see African Americans having the opportunity to educate themselves academically. Right after the Civil War is when we began to see a lot of some of these historically Black colleges and universities being created so that African Americans could have the opportunity to better themselves academically, better themselves, become better citizens, better themselves, but also to go out and to educate other African Americans so that they can begin to sort of build this process. I will talk about the Reconstruction period just very, very briefly, but I know that Dr. Williams, again, is the expert on that. But during Reconstruction, we began to see a radical change in terms of education, especially in the American South and as it relates to the state. Fisk University, also Howard University, these institutions were began by former generals, former officers, former officials in the Union Army. They came to the South and they wanted to give African Americans the best opportunity they could to be productive citizens in their own communities. So they wouldn't have to rely on their former enslavers to sort of direct their political and social livelihoods, basically.
So, Larotha, let me bring you in on that and get some additional context for that you might like to add.
HBCUs were established initially most of them were established to train Black teachers. But then as time progresses, you have the early colleges that are established during Reconstruction, such as Howard, Hampton, Fisk, and Tougaloo, and Talladega. I'm afraid I'm missing one. If any of my friends are watching this, they're going to get angry because how come you didn't say anything about my school? Atlanta University. These were the ones that emerged during Reconstruction. Most of them had the backing of religious or benevolent organizations and the Freedmen's Bureau as well. But as time progresses, they begin to take a more there's a vocational sort of ethos that begins to dominate them. That's largely because of Booker T. Washington, right? He goes down to Tuskegee and he establishes that. And many of you are familiar with, this model that he had, this based upon this philosophy that Blacks' most immediate need would be to learn skills, learn trades, learn vocations. So you have several colleges that emerged during this period that receive Morrill land grant funding. That is, these are grants that come from the federal government, encourage them to pursue like agriculture and some science and so forth. The federal government gave money to the states, which the states were supposed to match and give them to the HBCUs. But rarely did that occur. But most of the HBCUs follow this Washington model. And if you go and you look at some of the schools, um, such as Tennessee A&I, which was TSU's designation when it was first created, right? The A&I stands for agricultural and industrial.
Mhm.
Or I'm from Tallahassee, Florida, and the HBCU that dominates that area is Florida A&M University, so agricultural and mechanical. So they do this, but then they gradually get to the point to where they push toward walking the balance between liberal arts and these sort of vocational these sort of vocational schools or vocational pursuits that they really built their livelihoods on. And one thing to note when you talk about HBCUs is that there's and this figures prominently, I think, into our discussion today. Their relationship with the communities that surround them are intimate. I mean, very, very personal. Um, so much so, there's a friendly controversy or debate or rivalry, if you will, between HBCUs, could be in the same state or interstate. I didn't realize how much folks at TSU hated people from Tallahassee, Florida, from FAMU, but TSU hired me anyway, right? So, um, but it's something that's very powerful, so much so to the point to where the graduates almost become family in some regards, because the teachers that graduate from Fisk and graduate from TSU, chances are if they stayed in Nashville, they were going to be teaching Black students. The faculty and the administrators were held in high esteem in these communities. So someone, for example, like my friend Hannibal here, if he were to walk into a church, to say back in the 1930s, immediately they would know who that guy was. He was from Fisk University. But there was also um, it's also a responsibility that these schools had beyond education. That is, they were supposed to prepare the students for life after college. But by the same token, the work that they did there was to benefit the community. So at TSU, they have a garden that the community can come to and plant greens or whatever you want to. I just recently found out when you're raising chickens on campus, you can grow grapes for wine. There are goats on campus too. So the I guess I'm saying all that to say this: the relationship with between HBCUs and the community that they serve, something that's profound and is very different. I graduated from Florida State University, but I really didn't have any strong feelings for FSU, not like I did FAMU.
Well, that perspective is really valuable, and it's really helps give me a little bit of an insight. And I want to ask Andrea now to talk about this project. We're going to catch more history, but maybe bring us at this point a little bit up to speed on this project that you've got going on HBCUs and public health in Nashville. Andrea, can you tell us what's brought the three of you together in this project? What are you working on?
Yeah, so the three of us have worked together on other projects as well. And a lot of this is built on the back of the North Nashville Heritage Project, which I know Dr. Williams will speak about in a few minutes. But when we were thinking about, we saw the grant, the call for the proposals early, and we've been thinking through it for a few months. And Nashville's HBCUs, like Dr. Williams said, they are intimately tied with their communities, and they're in a close proximity to each other. And so Fisk, TSU, and then the other school is Meharry that really ties this project together, and that we have a Black medical school in Nashville as well. And so a lot of this project was thinking about what it means to have a Black medical school in this space, particularly when we're tying it back to previous pandemics, especially the tuberculosis. We were tying it back to, that was a moment where there had been more Black medical schools, but they were closed in the kind of in the shadow of the Flexner report, which streamlined a lot of medical schools and ended up closing a lot of Black facilities. And so it left just two, including Meharry. So we were interested in what it meant to have Meharry as a longstanding Black medical institution within these spaces of other HBCUs, and what that meant for a community. And again, like Dr. Williams said, how it interacted with North Nashville, as well as TSU and Fisk.
Lorotha, let me bring you back in, since Andrea was sort of telling us that you've been working on a previous project, this North Nashville Heritage Project, which seems to have laid out some of the groundwork for that. Could you tell us a little bit about that project? I think your microphone may be muted. No problem.
It began in 2010 when I was involved in something called the Gateway to Heritage Project. And this project was creating a plaza at the end of Jefferson Street that celebrated Jefferson Street as a business and entertainment district. So we had a former Freedom Rider give us a walking tour of Jefferson Street, and it was amazing. And I took my Black Nashville class on this tour. So we walked and we looked and we listened to the history. But then when we got back into the classroom, my students began asking me questions. And I will confess, if you see me doing something that's kind of interesting, chances are my students are the one that push me to do it. But one student remarked, that's all well and good, Dr. Williams, but what about the folks that lived adjacent to Jefferson Street, particularly the poor? And had to be kind of quick on my toes. I said, okay, what we'll do, we'll find out together. So put some recorders in their hands, and most of the students knew some people from North Nashville. And I asked them to talk to the elders to find out what we had perhaps been missing in our traditional look at the Strip. Now, this project was only supposed to last for 1 year, and it's 2021 now. But that's okay because we're continually incorporating more perspectives. We're asking better questions, and so perhaps this project was one that was supposed to evolve. Some of the lessons that I've learned from it was that I learned about the importance of cultivating relationships. Because initially we were just going out trying to get oral histories, but then people began to give me stuff. So you had to think about material culture. Then we had to think very seriously about how we would present this stuff to the public, because you're dealing with people's memories, things that are precious to them. So in this project, we've learned to cultivate relationships, so much so that we'll show up at their churches, go to their events, whether they're birthdays for the oldest person in the church or even some funerals sometimes. When they laugh, we laugh with them, and when they cry, we cry with them. So they know us. They reveal things to us the same way they would family, knowing that we're not trying to exploit them. And another really important thing I think that I've learned in the project is to pay attention to the people that that live their lives on the quote margin. Because oftentimes their stories, their memories, will enhance and sometimes challenge the narrative. I Since I started the project, I looked at the civil rights movement in an entirely different way than what I was trained, because I didn't think about the importance of bookies, people that would have money on hand to bail people out of jail once they got arrested. I didn't, I didn't realize how important maybe in the church, right? The lady that fries chicken, that makes dinner plates. I remember talking to a woman who said all she did was fried chicken during the civil rights movement. I was like, fried chicken for whom? And she said, for the students that got locked up. And it was amazing because she talked about frying a plate for the jailer to make sure that the students got fed. And the last point, and I can go on about the North Nashville Project, Heritage Project. Probably to pay attention to people that might not seem important. Even sometimes the guy that is amongst us that has the wild ideas. Because at the end of the day, what I'm seeing is that there are a lot of parallels between what we're observing right now in terms of protests and what we are protesting with what went on in the 1960s or 70s or 80s, even at TSU. So this project, even though it's supposed to be short term, we're still learning a lot. And every single student that I have helping me with it, it's building relationships with the community and challenging the narratives that have been taught to us. We're starting to think that, hey, all this stuff that I've been taught about Nashville might be inaccurate. It might be made up. But that's the project.
Thank you for sharing that. I want to underline a couple of things that I heard in there that really impressed me. One is giving credit to your students for coming up with good ideas and following their pedagogical lead. And I appreciate that statement and share that sentiment, absolutely. The other, and Hannibal, I want to bring you in now to talk about how the transition is going from that North Nashville project into what you're doing now in the middle of COVID. But I'm really struck by the importance, and I've talked to lots of people on COVID calls who have brought projects together very quickly in the middle of the pandemic, naturally, but how the preconditions that you've already established there in terms of relationships with the community that you'd like to interact with, the importance of that already being in place before the pandemic hits, so that when the pandemic comes, you can work a bit more quickly, I think, to frame out an oral history project that captures this time. Those are just to be seen very important aspects of this kind of work. Hannibal, let me bring you in on it, and maybe you can tell us how the current project you're doing attaches to what Larotha was just telling us.
No, and I think you hit the nail on the head, that the networks and the relationships that we already have as being professors within the community, it really helps us out a good deal as we move forward. Because COVID, it doesn't really answer to anyone. That's something that we've sort of been realizing. And so being able to move quickly, effectively, seamlessly has really helped. And so, for instance, our previous librarian at Fisk University, she has been there for quite some time. But when I brought the project, to her attention, well, she just started listing off different people that I should definitely talk to. She began to direct resources, my way that I should definitely follow. So we've been, and such as Dr. Ringer had mentioned, we've been looking at different troves of data. I know that once the I guess the archives, the Tennessee Historical Archives opens up, we're going to make use of that. But right now, we're looking at different archives from different other places. We're looking at special collections. And it also gave me the opportunity to kind of look more closely at even former HBCUs in Nashville. Tennessee State University, Meharry Medical College, and Fish University, as well as the American Baptist College. Those are the HBCUs now, but there used to be Roger Williams University as well. It was situated on present day Vanderbilt campus, their Peabody campus, but it was burnt down a few times. And the last time it was burnt down, they decided not to, resurrect it, just to move forward. But just having an opportunity to kind of comb through those records as well, because it is not just doctors and nurses that are responding to some of these crises. There are pastors. There are also people of the clergy. And Roger Williams University, American Baptist College, they produce a good deal of the clergy in North Nashville. So it's been good. We have plans to interview different individuals. These are, well, for instance, I'm in the midst of speaking to a former nurse. And actually, when I spoke to her, when I first broached the subject with her, she actually gave me the names of a few other nurses. A woman who I have known my whole life. I never knew that she was a nurse because she was always, retired. But I guess that kind of ages me. But she was a nurse. She actually went to Tennessee State University. And she went to the nursing program at Meharry. And I look forward to, speaking about these things with her as well, because I'm sure that there's just treasures like that in our midst that sometimes, we miss, but being able to get out into the community and have these conversations, have these discussions, you kind of never know what type of, jewels that you have in your midst. And so the thing about North Nashville, like in this sort of creates like a panoramic it shows us the beauty of creating this perspective of North Nashville's responses to pandemics and the like. And North Nashville is pretty much where the bulk of Nashville's Black residents dwell. Right, that's pretty much where the bulk. So, like Dr. Williams had mentioned, telling their story is integral. Being able to kind of go through the historical record and craft a narrative using their voices, it's essential, and it also has normative implications because we're able to learn from the past. We want to make sure that we don't make the same mistakes that we made in the past, try to learn from some of those things, but also maybe we can also pick up and do some of the things that we did really well in response to previous pandemics, because honestly, it's really a matter of life and death. So yeah.
Andrea, let me bring you in on that. Thank you, Hannibal, because that connection of the past and how it meets the stream of fear and concern and disease with COVID-19 is really important. Among historians, we don't have to explain this to each other, but outside of our group, oftentimes we do get asked, what's the point of history anyway? Why would we need to bother that? And we're focused on the future, and yet COVID-19 has demonstrated that past, we're talking, for example, of Meharry Medical College, that past of segregation and inequality in public health, that's not a thing of some distant bygone past. Mm-hmm. Andrea, your thoughts on that and how that kind of sensibility filters into the project that you're working on?
Yeah, absolutely. Going back to the connections built. Another way, what Dr. Williams said, where he always brings students in, he does. There are these connections that we already have with students. So another way that this project was able to move forward so quickly is we already had students to immediately hire, and on top of that, we already had folks who in all sorts of community positions that we were able to speak to as well. One of the perspectives that we're going to get on this oral history project is a student who is moving from graduating from TSU, going to Meharry in the fall. And we really want that perspective of someone who is choosing to enter medical school during a pandemic, what that means, what it's meant to move from an HBCU undergrad, right, to medical school. So those sorts of things have really made the project sort of seamless from the other institutional and community histories we've been doing.
Andrea, let me just stay with you for a minute because I'm also interested in how students there reacted last year. I mean, it was multiple disasters all in one disaster last year. I mean, we had the pandemic, but then we had the various murders that shocked Americans. And, campuses and cities erupted in necessary protest. How did that look there?
Yeah, we our disaster was sort of fourfold at TSU. We started the year with power outages. I know Dr. Williams will speak about that in a minute, but which speaks to structural inequality of how we didn't have those power grids updated. Then the pandemic hit. We had tornadoes that came through. A tornado that came through Nashville. It hit TSU, so we had millions of dollars of damage at TSU. That happened weeks after the pandemic hit, after the school closed. And then during the summer we had these protests, right? The Black Lives Matter protests, which had been ongoing, right? This is a years-long protest. And so for students, I think particularly in history classes, it's so integral that we are very upfront with it. We don't ignore any of that, right? Like all the history that we're talking about, I teach a lot of American history classes. It's all very tied into what happened in summer of 2020, right? And those protests. And so we come into the classroom virtual classroom in the fall. And that's very much part of what we're speaking about and talking about. And when this project as well, when we're thinking about the inequities, right, that exist within Nashville and elsewhere as well, it's very much part of, and resource inequities particularly, it's very much part of this project, right? And how we approach the importance of this is too.
Larotha, let me bring you in on this. And you were one of the authors of an editorial that was published in this context of the power outages in 2019, which is not something I was aware of, but I'm really impressed with what Andrea is laying out, is that in some ways you've been in continuous disaster there since the fall of 2019. What a toll that must take on students, faculty, and staff.
As I was listening to Andrea roll out all of the calamities we went through, she forgot about the Christmas Day bombing that occurred in Nashville. About that editorial, it highlighted an event that was a part of a much larger, much longer narrative, and that's the historical underfunding of HBCUs. That's not Tennessee State, because if you were to go to Jackson State, you probably could have the same story. But it's just remarkable that a lightning strike could shut down a university campus for, I can't even remember how long. It seemed like it went on for months because our students communicate with us and they complain, and it was a righteous anger. But then when we started thinking about, well, how the things get to this point, and it got to that point because the school has been underfunded. So you have to take money to do things maybe for the College of Ag that you were supposed to use someplace else. Then when we make requests to the state, you ask for $1 million and they give you $200,000. I'll probably never be president of a university because I don't know what to do with that. But this year has taught me just how vulnerable our students really are. Things that we would assume that they would have. They don't. Something as simple as reliable internet, which, us as professionals, we take for granted. Or just having a computer in the home. But then you got to couple that with the fact that they are in the midst of a pandemic where they are getting sick or their family members are getting sick and they die. Or get sick and the period of convalescence is really long. A year ago, I was getting emails like every other day from a student telling me that maybe a family member was sick, and sometimes they would send obituaries. And so I got to the point where I said I was going to be lenient with them because I kind of understood what they were going through, right? My mother passed away from cancer when I was my last year of grad school, and I had to stay in grad school next year because it took me a year to get my mind right to where I could actually study. But we're dealing with 18, 19, 20-year-olds now. We're trying to work their way, trying to process that type of trauma. And then for me as a professor, right, you get a student. As professors, we might have one or two students that are dealing with these sorts of issues, whether it's illness or whether it's death in the family. But I don't think any of us have attended a grad school that prepared you for half the class being sick or 75% of the class dealing with family illnesses, and they really don't know whether or not the family is going to recover. And then with this new style of teaching that we're doing, I've been teaching online classes now for about 7 years, and I volunteered because I figured, I said, hey, this is one day I might have to do it. And this is the day that I have to do it, but it's under so much stress. I'm having to just rethink pedagogy. I'm just having to rethink the kind of relationship that I have with students. And right now things seem to be getting better, but I can't really say when the end will finally come, whether we'll ever get back to the thing that we define as being normal, if that'll ever exist again. So this year has been enlightening for me because I always prided myself on recognizing the humanity of my students, right? I've never lost track of the fact that these are young people and they're having young people issues, but now I'm remembering to rethink that just in terms of how I'm dealing with trauma, how I'm dealing with people that might be hurting, that want to do the assignment but can't really do the assignment properly because their minds aren't where they would normally be. And then for me as a professor too, you can't hear all that stuff and it not have an effect on you, on everything from how you assess them to making a determination on what assignments you give them. So that's what this year has been like for me.
Just want to remind everyone that you're listening to COVID Calls, and I'm talking today with Hannibal Leach, Larotha Williams, and Andrea Ringer about HBCUs and public health in the COVID era and the project they're working on around that. Hannibal, just to bring you back in, something very powerful in what Larotha was talking about there, the power of an oral history project to facilitate community interaction, relationships, listening, but also students. And I can't help but think that of course, there's a value to future historians and journalists, and we hope policymakers who'd like to know what COVID time is like in Nashville. But there's also seems to be, what I'm hearing, a value in the moment in terms of almost a therapeutic effect of engaging these discussions. I wonder if that's by design in this project, or is that just something that you're seeing emerge with a project like this?
Well, a good deal of engagement with the community is something that we definitely all wanted to take on, but to see the level of engagement that the members of the community actually want to have themselves, that's something that is impressive for me as a social scientist. I need information from members of the community a great deal, and my history or my experience has been people have been very reluctant to do the interviews, do those surveys, to meet you at different places and things like that. People have been sort of reluctant to do that, but in this project, we haven't really, well, at least myself, I haven't really seen that. Everyone that I have engaged with has been very helpful. At an institutional level, our special collections at Fisk University has sort of been closed. But when I brought the project to them, they were very happy to make a lot of things available online. They were able to sort of open up so I could go in there, physically, even if I wanted to kind of access different materials and the like. So it's been a very enjoyable experience dealing with that. And I think even from the students' perspective, of course, I won't tell my faculty, but I won't tell the names of my faculty, but really just sort of, making sure that I even document the notes that I take throughout the day about, kind of what's going on in my own day. Because early on, so like Dr. Williams had mentioned, this was an experience that was very new to a lot of faculty. Having students going home very abruptly, and professors, we want to continue to preserve the academic integrity of the university, as well as we also want to maximize the educational experience. And so we want students to be engaging even online, even when we do projects and things like that. And many professors had a hard time realizing that, students, not every student is like your typical student with a cell phone, or this, that, and the other, the smartphone. Many students don't have a camera on their cell phones. Mm-hmm. And so this is something that we had to find out the hard way. Many students don't have a camera on their computers. And a lot of us had to find this out the hard way. So it took a lot of massaging and talking and meeting with our own faculty to sort of get them in the space so that they can understand to just be a little bit more sensitive in this time when it comes to things like projects, when it comes to things such as papers, because some students can write do their work on their smartphone, but some work just doesn't. It's just a little bit more complex where you can't do these sorts of things. And even when you look at the makeup of a lot of our students, and a lot of our students are in, small rural towns in West Tennessee, even East Tennessee, A lot of our students come from the Delta areas of Mississippi and Alabama. And unfortunately, many of these areas, they live in counties where, they may have a public library, they may not. And the public library may not even have internet. And there's a place in Mississippi known as West Point. West Point, well, if you know anything about West Point, if you don't have a landline, then you are pretty much screwed, because there is no cell data there. You can't call into a cell phone. You can get a text through sometimes, but to call, it's pretty much impossible. So if you're trying to use your cell phone or anything like that to do work or to engage with your professor, that sort of thing you're going to have to go to another county for that. But I say all that to say that this sort of thing needs to be documented. It needs to be part of the narrative, so that we can kind of get a full view of what life is like in these sort of pandemics, what type of challenges, people in professional settings. And I always say, college is a professional setting. The people that make up our students, they are young professionals, they're young scholars, and they're professors. So even in the professional setting, we still have a lot of work that we need to do to make sure that, when we have these situations, that we are cognizant of sort of what could come about in these sorts of situations. From a student's perspective, we have, Dr. Ringer has a few students as well, and I've brought the project up to a few students as well. And the students, they feel the same way, right? Unfortunately, many colleges, this could be the death knell for a lot of colleges. This could be like the final blow. So if you were a college and you were teetering on the edge before the COVID-19 pandemic could be the straw that broke the camels or the horses, the back, basically. And I say that because from a student's perspective, going to college is one of those things that is like the culmination of your entire childhood, right? It's like the culmination of their entire childhood. And from the conversations that I have with students, a lot of the students need to come to college. They need to sort of get out of the household sooner rather than later, because of things that are going on in their own lives, things that are going on in their neighborhoods. They need the space outside of their own immediate household in order to think clearly, to study. They need to see professionals that look like them. They need to see professionals, people that sort of care about their intellectual trajectory and things like that. So from the student's perspective, from what I hear, it's been very tough, but being able to articulate, what they're saying into this narrative is going to be important. And, I think that a lot of people are looking forward to, the culmination of our project, because you're going to see a lot in it that maybe we took for granted.
Andrea, let me bring you in on that. And I just want to make sure I note how much I love the respect with which you all talk about your students. I mean, it's not necessarily the focus of our discussion here today, but it's come through this entire conversation that you see them as collaborators and talk to them as professionals. And that's just really important, I think. And of course, that also helps build a culture where you're going to get a project like this done. And that's important too. Andrea, to that point, what will the outcomes be? I sometimes get a note, just the other day on COVID calls, I got a note from a listener who said, I like COVID calls, but talk about solutions a little bit more. I said, okay, well, let's do that. What are some of the, I don't want to leave people with false optimism, but what are some of the things you think that might be gathered as lessons, outcomes, possible solutions that might come from a project like this as you document what's happening right now with COVID there?
Yeah, one of the pushes at TSU that we were making, Dr. Williams and I were making about a month prior to the pandemic breaking out, and we're still in the midst of it, is a paid family leave policy. So we had been pushing on campus. We don't have any paid family leave at TSU, and this, is common in the South. We don't expect any paid family leave coming down as a state law, and so it's something that we're trying to push through the faculty senate. And COVID, even though that's what we wanted, was this inclusive family leave rather than like maternity leave or paid parental leave. What COVID allowed us to do is really be able to show how important it is to have paid family leave, how important it is when you have a family member who falls ill, and to be able to take care of that person. And so, we're still in the midst of that, but policies like that, I hope, are some of the things that are going to happen on campus and change, where these conversations, we can have them more openly. I think they're more accepted of, we need to think more holistically about folks working on campus, right? So I'm hoping like documenting things like that are going to be really, really important, documenting the sorts of things that we're seeing on campus. And, like Dr. Williams and Dr. Leach said, just the experiences, particularly of our students. We've had a lot of deep conversations of where these oral histories should go, and will go. And we are talking with like Meharry grads who are in the Nashville community, but also with folks who, again, we know through the classroom, right? Thinking about what that experience has been like, just being in that, like Dr. Leach said, documenting these things. And again, it really works off of kind of the framework that Dr. Williams set up with the North Nashville Heritage Project, right? Of like who we were speaking to are these folks often who wouldn't be spoken to in an oral history project. And so we are thinking about the historical trajectory and using oral histories for that, but also thinking about documenting the contemporary moment with those. As far as what the project will look like, we have this oral history collection. We have an Omeka site. We have a graduate student, a computer science graduate student working with us. So that'll be part of the public facing part of it. And we also have a blog series through History at Work, which is a public history, through the National Council of Public History, where we're going to sort of bring these together and sort of stories and how folks throughout history in North Nashville have sort of contended with pandemics.
That's quite a lot of outputs that you're imagining there, and that's really exciting to hear. Just Andrea, let me stay with you 1 second, and then Larotha, I'm going to turn to you for maybe a final word. But because this came up in the previous COVID calls I had around Philadelphia, talking particularly with some folks advocating for a just recovery in Philadelphia from the pandemic, and we talked a lot about college students and the fact that there might be a sort of general perception out there that, all college students are wealthy and privileged. And so, something like a pandemic won't affect their lives. And I'm sure that may be accurate for some subset of American college students or around the world, but I think it's not true in the main. Mm-hmm. And that even in Philadelphia, lack of access to food, students going hungry, students without a cell phone plan, as Hannibal was saying, students who don't have access to the internet, and we just assume we can flip the switch and turn the university into an online experience. Documenting those needs is not just about the future, it's also, I would hope, about getting the interest of policymakers in the now. I don't get the sense that your project is structured to be political necessarily, but how can it not be?
Mm-hmm. Yeah, a lot of our students are essential workers. When COVID hit and so many of us got to sort of bunker down in our homes, they didn't. I had students whose work schedule doubled essentially, right? The folks that were working at Walmart and Kroger and things like that. And these spaces that didn't close. And so, yeah, I mean, that's a more typical experience of a lot of our students. So yeah, I think that's important to sort of bring to the light with this. And, you know, thinking about just, again, inequity in general, the quote that really stuck out to us, the reason we decided, yeah, let's go ahead and engage, let's put this proposal in, is Dr. Hildreth, who's the president of Meharry. He gave a congressional testimony pretty early in the pandemic. And the quote that I just remember so vividly, he said, arm us with resources, talking about Meharry, right? Send resources. And if you send these resources, we can do something with them. And that just struck me because they're in all the things, because we had been collecting newspapers and kind of looking at pandemics, we had seen that echoed so many times of this is a lack of resources, right? And if you send the resources, and it's been amazing. And part of what I'm really excited to bring to light is what Meharry has done, right? The role that they have played as a testing site, as one of the major testing sites here in Nashville, and vaccination, you know, and vaccinations as well. So I'm really excited about that part of it too.
Well, thank you for that. We're almost up on time with my guests here on COVID Calls today. And Loretta, I want to turn to you maybe for a closing word. We really appreciated when we talked about the history of HBCUs, and we kind of have traced that history, you know, through time from the Civil War forward. Thinking about that, I'm just really struck by the fact that if you wanted to understand higher education in America and how it has persevered in the face of disaster, that HBCUs would be the place you would start. I mean, talking about founding these in the aftermath of the Civil War and through the Reconstruction period, and then of course, Jim Crow and a continuous set of struggles, often with protest and violence, either in the neighborhoods surrounding these campuses or on the campuses themselves. And now we find ourselves in COVID. There is, to me, a striking continuity there. And I guess I wonder if you could reflect on that a little bit, because I think that to me is something I'll really take away from this conversation.
TSU is my second job. My first job was in Savannah, and as one of the few Black faculty on a predominantly white campus, I was like the academic advisor for every group imaginable on campus. But one in particular, I was the faculty advisor for the NAACP, the student chapter of NAACP. And I would take our dues or whatever money we made to the president of the city chapter. And the president at that time was a former president of Savannah State University, which is an HBCU. His name was Dr. Prince Jackson. And he asked me a question one day. He asked me what I plan to do at Armstrong. And I was like, well, we're working on establishing a Black Studies program. And I want to do this, that, and the third, right? But then he also, he said this to me. He said, whatever you do strive to do something that matters beyond academia, beyond the ivory tower. And I think that's the whole ethos of historically Black colleges and universities. Because in order to remain at these sites, we have to do the same thing everybody else in academia does, you know, publish or perish and so forth. But I see my position at TSU is requiring a little bit more than that. It requires us to prepare our students to be valuable beyond academia, but also, if possible, to engage in research, engage in projects such as the one that Dr. Ringer and Dr. Leach and myself are involved in. Things that's going to resonate beyond the ivory tower. I'm involved in this, but my motives are not entirely just benign, right? Because whatever we come up with, I'm going to present this to our policymakers and point out how the flaws that we uncovered are not aberrations. This is how it usually goes in North Nashville. Whereas this community has typically been one of the poorest in the city. In the quote, it city, it has always been one of the most neglected parts of it. So when we look at this, and we'll see by the time all this is said and done, we'll see how we had people that were living blocks away from Meharry Medical College struggled to get a COVID test, or they struggled maybe getting transportation to vaccination sites. So in looking at this project, and it's a scholarly project, but it's in my mind, it's going to be political in that it'll help hold a mirror up to the city to show it and the world, what we really are, and how oftentimes our words don't line up with our deeds, with our actions. But I think on the back end of it, I think this will be something that we and our students will remember going forward, because anticipating questions 10, 15, 20 years down the line. What were you doing during the pandemic? Well, I know one of our students will say, hey, I made an Omeka website. By then people will be like, what's Omeka? What is that? But then you have others that said, I remember talking to this nurse who graduated from Meharry Medical College about this period. So the importance of the work that we're doing is slowly dawning on me. And who knows, it might be a historic thing. You might have a Ringer Leach Center at Fisk University one day because of this. I don't know, but I'm hoping for it.
I wouldn't doubt that for a minute. And realizing as we're talking, I'm going to need to, so consider this the invitation. I'm going to need to bring you back in about 6 months so that you can update us on some of the data collection and what that's meant. What a privilege to speak to you all today. And just to remind everyone that you've been listening to COVID Calls, and you can catch COVID Calls every weekday at 5:30 p.m. Eastern Time. A program note that on Monday, we will have a special time, 10 a.m. Eastern Time. I'm going to be talking to Georgia Representative Nikema Williams, an extraordinary representative, new member of the House of Representatives. She's a representative of the Georgia 5th District. So I hope you will join me for COVID Calls, special COVID Calls on Monday at 10 a.m. And just to thank my guests again, Larotha Williams, Hannibal Leach, and Andrea Ringer, thanks for what you're doing. Thanks for taking time at the end of the day to explain it to us all, and best of luck with the project.
Thank you.
Thank you.
Thank you. Thank you very much.
Stay healthy, everybody, and we will see you on Monday, 10 a.m. Eastern Time.